Hey everyone, Jim here with Total Health Turnaround. If you're over 50, your heart may not warn you with movie style chest pain. Sometimes it whispers first. Shortness of breath, unusual fatigue, swelling, dizziness, or chest pressure you keep calling heartburn. Today I'll show you 5 signs to watch for, when to call the doctor, and one 2-minute check you can do today. Before we begin, this video is for educational purposes only and is not medical advice. If you have chest pain, chest pressure, shortness of breath, fainting, severe weakness, pain spreading to your arm, jaw, back, or neck, or symptoms that feel sudden or serious, call emergency services right away. Do not try to tough it out. Now, let's get into it. Sign number 1, you get short of breath doing things that used to be easy. The first silent sign is shortness of breath that feels new, unusual, or out of proportion. Maybe you used to walk to the mailbox without thinking about it. Now you have to stop halfway. Maybe climbing stairs suddenly feels harder. Maybe carrying groceries leaves you more winded than it should. Yes, being out of shape can make you short of breath. Lung issues can do it, weight gain can do it, and anxiety can do it. But your heart can also be part of the picture. Your heart's job is to pump oxygen-rich blood to the rest of your body. If it's not pumping as well as it should, ordinary activities can start to feel harder. One important clue is change. If you've always gotten winded on hills, that may just be your normal fitness level. But if something that used to be easy is now making you breathless, pay attention. Especially if it comes with chest pressure, dizziness, sweating, nausea, or unusual fatigue. What to do instead of ignoring it. Start tracking when it happens. Does it happen walking? Climbing stairs? Lying flat? At night? After meals? Only with exertion? That information can help your doctor figure out whether this is your heart, lungs, fitness level, medication, anemia, or something else. The key is this. Don't automatically label new shortness of breath as just age. Age may be part of the story, but it should not be the excuse that keeps you from getting checked. Sign number 2, chest pressure, tightness, burning, or heartburn during activity. The second sign is chest discomfort that does not feel like sharp pain. A lot of people think a heart problem has to feel like dramatic chest pain. But sometimes it feels like pressure. Tightness, fullness, burning, heaviness, or an uncomfortable squeezing feeling. Some people describe it as indigestion or heartburn. Here's the important part. Pay attention to when it shows up. If you feel chest pressure while walking, climbing stairs, carrying something heavy, mowing the lawn, or doing physical work, and then it gets better when you rest, that is something to take seriously. That pattern can be a sign that your heart is asking for more oxygen than your blood vessels can deliver. Now, not all chest discomfort is heart-related. Reflux, muscle strain, anxiety, and other issues can cause chest symptoms too. But after 50, especially if you have high blood pressure, diabetes, high cholesterol, extra belly fat, smoking history, or family history. You do not want to guess. Here is the simple rule. If chest discomfort is new, worsening, happens with activity, or comes with shortness of breath, sweating, nausea, dizziness, or pain spreading down your arm, jaw, neck, or back, get medical help. And if it feels sudden or serious, call emergency services. Do not drive yourself. Do not wait to see if it passes. This is one of those moments where being tough can backfire. Real toughness is getting help before things become a disaster. Sign number 3, unusual fatigue that does not match your day. The third silent sign is unusual fatigue, not normal tired. I'm talking about fatigue that feels strange to you. You slept, but you still feel wiped out. You do one small chore and you feel drained. You sit down and you think, why am I so exhausted? You feel weaker than usual without a clear reason. This one is tricky because fatigue has a lot of possible causes. Poor sleep, stress, low protein, low vitamin D, anemia, blood sugar problems, depression, medication side effects, dehydration, but heart problems can show up as fatigue because if the heart is not pumping efficiently, your muscles and organs may not be getting the oxygen and blood flow they need. The big clue, again, is change. If you are suddenly more tired than usual, or your energy drops along with shortness of breath, chest discomfort, dizziness, or swelling in your legs, do not brush it off. And for women, fatigue can be especially important because heart attack symptoms may show up differently than the classic chest clutching movie scene. But men should not ignore it either. After age 50, unusual fatigue is your body's way of saying something needs attention. It may not be your heart, but it's worth finding out. One practical step: write down when the fatigue happens. Morning, after meals, with activity, when you're at rest, after poor sleep, with chest pressure or shortness of breath. That pattern is valuable. Your doctor cannot see your daily life. You have to bring the clues. Sign number 4, swelling in your ankles, feet, legs, or sudden weight gain. The fourth sign is swelling in the lower body. If your socks leave deep marks, your ankles look puffy, your shoes feel tighter, or your legs swell more as the day goes on, that can be fluid retention. Now, swelling can come from many things. Too much salt, sitting too long, vein problems, kidney issues, medications, injury, heat, travel, But swelling can also happen when the heart is not pumping strongly enough and fluid backs up in the body. This is one reason heart failure symptoms can include swelling of the feet, ankles, legs, belly, or even the neck veins. And I want to be clear, heart failure does not mean the heart has stopped. It means the heart is not pumping as well as the body needs. That is serious, but it often can be managed much better when it is caught and treated. Here are a few red flags. Swelling that is new. Swelling that is getting worse. Swelling with shortness of breath. Swelling with sudden weight gain. Swelling along with needing extra pillows to breathe at night. Or waking up short of breath. These are not things to ignore. A simple way to monitor this is to weigh yourself at the same time each morning for a week. If your weight jumps several pounds quickly and you also notice swelling or breathlessness, call your healthcare provider. That is not about vanity. That is about fluid. And fluid can be a clue. Sign number 5, dizziness, lightheadedness, or a racing or irregular heartbeat. The 5th silent sign is feeling lightheaded, faint, unusually dizzy, or noticing your heart racing, fluttering, or beating irregularly. Now, once again, this can have many causes. Standing up too fast, dehydration, low blood sugar, medications, inner ear issues, anxiety, too much caffeine, but sometimes dizziness or palpitations can be connected to heart rhythm problems, blood pressure issues, or circulation problems. A racing heart once in a while after stress or caffeine may not mean much. But if your heartbeat feels irregular, if episodes are new or frequent, or if dizziness comes with chest discomfort, shortness of breath, fainting, sweating, or weakness, do not ignore it. Especially after 50. Your heart has an electrical system. When that rhythm is off, blood flow can be affected. If you actually faint or feel like you might faint with chest symptoms or shortness of breath, that deserves urgent attention. One practical step: when you feel it happening, sit down safely. Notice your symptoms. Check your pulse if you know how to. Write down the time, what you were doing, how long it lasted, and whether you had chest pressure, breathlessness, sweating, or nausea. That information can help your doctor decide whether you need an EKG, heart monitor, blood work, or other testing. The goal is not to panic. The goal is pattern recognition. Here is a quick recap. The 5 silent signs your heart may be struggling after 50 are: Number 1, shortness of breath, doing things that used to be easy. Number 2, chest pressure, tightness, burning, or heartburn during activity. Number 3, unusual fatigue that does not match your day. Number 4, swelling in your ankles, feet, legs, or sudden weight gain. Number 5, dizziness, lightheadedness, or a racing or irregular heartbeat. These symptoms do not automatically mean you have heart disease, but they do mean your body may be giving you information. And information is not something to be afraid of. Information is something to act on. Okay, here's your 2-minute action step for today. Write down your personal heart baseline by just answering these 5 questions. Can I walk up one flight of stairs without unusual breathlessness? Do I ever get chest pressure, burning, or tightness with activity? Have I felt unusually tired for no clear reason? Are my ankles or feet swelling more than they used to? And have I had dizziness, faintness, or heart fluttering? That's it, 5 questions. If you answer yes to any of these, especially the symptom is new, worsening, or happening with activity, bring it up to your doctor. And if symptoms are sudden, severe, feel like an emergency, call emergency services. Don't wait. You're not bothering anyone, you're protecting your life. After 50, protecting your heart is not just about living longer. It's about staying independent, having energy, walking without fear, playing with your grandkids, traveling, working, and enjoying your life. Your heart does a lot for you. So when it whispers, listen. If this video helped you, let me know in the comments which sign surprised you the most. And if you're over 50 and working to improve your health one step at a time, subscribe to Total Health Turnaround. Remember, we're not trying to live forever. We're trying to live better for however long we're here, and progress beats perfection. I'll see you in the next video.